I'm going to talk to you about one of the reasons injections like PRP and exosomes and whatnot may fail. And that failure is a lack of understanding of where the hair follicle is below the surface of the skin. So I'm going to use a tool to kind of show you. So let's look at the different methods we can use to look at structures below the surface of the skin. We've got the CT scan, or computerized tomography. We've got the MRI, or magnetic resonance imaging, and we have the ultrasound. Now, the ultrasound has the highest axial resolution of all three. In fact, at 70 megahertz, it has a resolution of 30 micrometers per pixel. Now, that's about half the diameter, a little bit less than half the diameter of the average hair follicle, whereas on an MRI scan, it's around 400 micrometers per pixel, which means that the smallest thing it can pick up would be about the size of 6 hair follicles. So it just doesn't have the resolution for us to be able to see hair follicles below the skin. So let's look at a 70 megahertz ultrasound of the skin compared to an 18 megahertz ultrasound. Ultrasound has basically different shades of white and black. Some would say it would be shades of gray. But there are hyperechoic structures, which are white, and hypoechoic structures, which are black. And the hair follicle falls somewhere in between. So we can see on this lower image at 70 megahertz that we have this hair follicle that's growing into the skin and through the hypodermis and into the subcutaneous adipose. So, you know, the darker structure here is the dermis, the whiter. And as we lose, or it becomes more translucent in the hypodermis or subcutaneous adipose, the bulb is down in this region. So the overall depth of the skin isn't that great. Now, hair follicles can grow at different angles to the skin. And so at roughly 60 degrees angle to the skin, that hair follicle is going to be will grow deeper. But average follicle is going to be somewhere below 45 to 30 degrees angle to the skin. And so we can use trigonometry to determine how deep that follicle is. In this particular case, where it's about literally 43 degrees angle to the skin, and you can see these hypoechoic structures, these are all hair follicles that grow in an angle. The actual depth of that bulb is about 3.34 millimeters below the skin. And what does that mean? Well, if you inject below 3.34 millimeters, the growth factors in your PRP are not going to hit that hair follicle. It's going to go below it. So if the hair follicle is growing at a more acute angle, in this case 30 degrees, that hair follicle is residing at about 2.45 millimeters below the skin. And the dermis is about 2 millimeters deep. So it's just into the adipose. Well, here you need to be somewhere between 2 and 3 millimeters with your injection. Otherwise, you're going to be too deep for the hair follicle. You know, things aren't going to go against gravity. They're not going to go up toward the surface of the skin. They're going to go down. So let's take a look at some video imagery. And here you can see we're using ultrasound, and we can see how deep this needle is. It's 1.8 millimeters. And the total surface of the scalp from the epidermis down to the skull, this hyperechoic structure here is the skull, is about 8 millimeters. And here's your needle. So you're in an okay depth there, but you're going to be in the dermis. Now, what about this this image below it? Now you see this needle's coming in, and it's about 3.8 millimeters deep. So we preferentially like to be a little bit more shallow than that. So if you use, let's say, a 4 millimeter long needle, and you inject at an angle of about 30 degrees, you're going to be in the right depth. Now your problem is you have to find a 4 millimeter needle it should be about 25 gauge needle. Anything smaller could damage the platelets when you inject. So unless you're lysing the platelets prior to injection, you need a little higher gauge needle. So all these things can lead to problems with the injection of PRP or exosomes or other things that are targeting hair follicles to stimulate hair growth.
Forehair is run by Dr. Cole with 30 years of few hair restoration experience, and we offer the most cutting-edge technology available. In fact, the Forehair Enterprise sub-company Cole Instruments manufactures custom-made tools and automated tools for hair restoration physicians all over the world. Our quality, expertise, and skills are superior to other clinics. Our reputation and results are the best in the world. It's time to restore your hair. It's time to choose Forehair.
We hope you enjoyed the video. Don't forget to hit the little bell button to get notifications of Forehair's video uploads. For online consultation, click on the link on the screen or in the video description.